Then let's talk about some herbs or other nutrients that may use to help joint issues.
Absolutely. So with certain nutrients there, of course, collagen is going to be number one. Typically, hyaluronic acid is going to be part of the collagen byproduct. Okay. You can also do things like magnesium and calcium will still be helpful. Vitamin K is really important because that's going to help get that calcium into the bone. So we need to make sure that we have good vitamin K, ideally K2, which is going to come from quality animal products. So if we can consume things like egg yolks and grass-fed butter and ghee, that's going to be essential. If we have problems with butter or ghee, then we probably want to look at making sure we supplement that or get it from a good quality fermented cod liver oils. We got to keep an eye on if we can get good quality butter or ghee in there, you're probably going to be okay with your K2. If not, we'll have to supplement that. I would also say just making sure you have a good multi to get all those extra other minerals that we need, like selenium and zinc and calcium, magnesium are going to be typically separate. And then, of course, you're going to have copper. And of course, your fat soluble vitamins are going to be very important. So you got to make sure those are all present, your vitamin K2, et cetera. As a female, especially as you get older, lower levels of progesterone and estrogen before menopausal age are going to be a detriment because progesterone helps stimulate osteoblasts, which help build up the bone. Estrogen helps stimulate osteoclasts. So if we start getting more estrogen dominant, we're more likely to be breaking down the bones. And then as you go menopausal, you want some level of hormone support to help support bone health because going super low, that's going to prevent your body from building healthy bone. So making sure the hormones are dialed in and making sure we're testing the hormones is going to be ideal. And then of course, resistance training is going to be helpful, right? We grow, our body adapts by demand. It's what's called the piezoelectric effect, where you can stimulate bone building through stimulation, whether it's resistance training or whole body vibration or using bands or doing some kind of an interval on a elliptical or a rowing device. Something like that's going to be very helpful to stimulate healthy bone growth. So we need that as well. And then I would say last component is making sure your joints are pliable, making sure your muscles are pliable. Your muscles are shock absorbers for your cartilage and for your bones. So if we have excessive wear and tear because your muscles or your natural shock absorbers aren't working, that's really important. So, you can get your muscles turned back on with applied kinesiological techniques, various soft tissue techniques like myofascial release or ART or Graston or like muscle spindle techniques, or we can even use bioelectric devices like the Newbie, for instance, which really help stimulate the muscles so they can work again. They help reduce inflammation. All these things are helpful. Seeing a good chiropractor that can test your muscles to see which ones are on or off can be helpful because a lot of people that have a joint issue at the knee may have issues at the ankle or the hip above. So a lot of times where joint issues manifest, the problem is usually above and below the joint, and that gets ignored. And you see a physical therapist and they only want to work on the knee. They don't go upstream or downstream. So kind of like in functional medicine, we're always looking upstream. If you're working with a good PT or a chiro, you want to make sure you're looking upstream from just the knee, hip and ankle. You got to look at both of those places. If you have an issue at the hip, you want to look downstream at knee and ankle and upstream at the back. So you got to look at this holistically.
Yep.